Hello, 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 Naperville and Aurora. Today I'm doing another Facebook Live interview with another practitioner, another health-related industry expert that is in your local community. I wanted to bring awareness to what he does and the company that he works for, what they do and what they have to offer. Maybe you guys know about them in the community already, or maybe you haven't and you would like to learn more about them. So today, I'm very excited to bring you John, who will be connecting pretty soon here, and then we'll start the interview. John is a master level exercise physiologist with Achieve Orthopedic Rehab Institute. So he's also the head strength and conditioning coach at Hinsdale South High School as well. So he's really well qualified in the space of exercise physiology. And hey John, how you?
Go ahead, sorry.
You're good. You're
I'm
good.
good. How are
How
you
you
today,
doing?
Dr. Robinson?
I'm doing pretty good. Can't complain. It's been a rough week, but today's
Yeah, I
going
hear
well
you.
so far. So I gave the brief introduction to you already for everyone who's here
Perfect.
and listening. But why don't you fill in the gaps more about who you are, what you do, who you work for, and
Sure.
fill in the gaps for us.
So right now I work for a company called Achieve Sports Medicine or Achieve Orthopedic Rehab Institute. We're a primarily manual therapy-based
Mm-hmm.
sports medicine clinic that has a large emphasis on aggressive exercise routines along with manual therapy to help patients who are, either having just some normal aches and pains from being extremely active, along with anything post-surgical, total knee replacement, shoulder repair, ACL repair is a lot of our patient base. So in the clinic, I'll work with patients one-on-one with the therapist as we're progressing the exercise routine. In addition to that, I'm the head strength conditioning coach at Hinsdale South High School. I do a lot of body composition
Mm-hmm.
assessments with Achieve using some of our technology. And I do some metabolic testing like resting metabolic rate assessments along with VO2 threshold testing. So that's all kind of a combination of the things that I do at Achieve, along with just some general consultations about weight loss, fitness, muscle gain. Do a lot of that with some of our patient population. So that's kind of a little bit about me and what I do here.
So yeah, let's take a step back because that all makes sense to me and you. But for some people that may be watching that have no idea what a VO2 max test is or manual therapy or anything like that, can you break it down into more of the terms of what it means to the
Sure,
layperson, and then why would they want
sure.
something like that in particular? And if we have to keep it to just VO2 max in the beginning, like why would somebody want VO2 max, something like that, just so we
Sure,
don't lose
absolutely.
anyone.
So VO2 max assessments, what VO2 stands for is your ventilation of oxygen threshold. And what that means is that your muscle and your body can only take in so much oxygen at a time to utilize for exercise in order to fuel the burning of fats and carbs, aka keeping you going. So what I'll do is I'll have that person exercise on a treadmill on a bike and they'll be wearing a mask. And that mask analyzes the amount of oxygen they take in and the CO2 that they let out, which is an indication of how hard they're working during
Hmm.
exercise. This is good for somebody who's an elite, high intensity athlete, such as an ultra marathoner or an Ironman triathlete, or just the average person who's looking to see what heart rate zone is the best for them to burn fats and when they're using carbs, which is important for weight loss and general health. So something like that would be kind of across the board beneficial for any patient client who's looking to get into fitness, coming back from a injury or such. So that's what I would use that testing for.
Okay, yeah. So I mean, if anyone hasn't done that VO2 max, I did it in undergrad. Like I told you, I had the exercise
Yeah,
science undergrad degree. I did it in undergrad. It's very tough, but it's very interesting too to get a really good idea of what your
absolutely,
threshold is. You can learn more a lot, about what you're doing and
for
then what
sure.
your capacity is too. And then my understanding is you can use it as a measure to track progress too and how you're progressing
Absolutely.
in your
So
goals. So
anybody who's
yeah.
training for anything, and training is a broad term as far as fitness goes, either looking to get better at their
Yeah.
sport or just looking to become more fit and healthy, you can assess their progress in gains of
Hmm.
VO2 along with the changes in their heart rate. And that'll be something that is cumulatively added from any type of exercise program that's programmed effectively.
Yeah, so I mean, before we jump into some other questions here, it really sounds like you guys can take athletes and especially elite athletes and help them progress and get even better results, what they're looking for. So you guys can take somebody and really
For
get them to
sure.
the next level.
And even with that too, everybody thinks of VO2 max testing like you're going to pass out on a treadmill. I've done a lot of in-clinic work with patients in their late 70s, early 80s. I've tested some 90-year-old patients who are really just looking to assess how can they improve their quality of life. So with that too, that technology doesn't need to be an all-out high-intensity exercise test. It can be simply a walking program or an easy cycling test as well. So kind of cool to see that in too, is that, you know, I always preface that I work with athletes, but my background is clinical with patients in cardiac rehab and stress testing. Yeah.
Very interesting. Makes sense. So let's dive in a little deep then. Like, let's give the people around Aurora, Naperville, and around this area just a good look into what you guys do more specifically. So, what if you had to pick one thing, like one thing that sets you guys apart from somebody else that does similar services down the road from you or in a different city? Like, what really sets you guys apart? What would you like to highlight and tell everyone about? Like, hey, we do this here. Nobody else does this, and we
Sure.
do this really well.
So I think anywhere that you go, they're going to tell you, hey, we do some manual therapy. We also do exercise with our patients. But what we do best at Achieve is providing excellent patient quality care, one-on-one from the therapist, along with the technician staff. So all of our techs are highly certified, whether it's postgraduate certifications, graduate degrees, or undergrad degrees. Working one-on-one with a patient is our primary goal.
Sure.
So ensuring that not only are they coming in and getting excellent quality manual therapy, which is adjusting the soft tissue, whether that's through advanced or ART technique along with dry needling and such like that, we do that well. All our therapists are highly certified. But in addition to that, when they get off the table or after they've exercised, we know what to do to progress them in clinic and out of clinic. So you come to Achieve and you have an issue, not only are you going to leave feeling better, but you'll be stronger than before, because that's our main goal, is that if you come in and it's a deficit due to weakness or a poor movement pattern, we're going to fix that, and we're going to fix it quick. You're not going to be in PT for 2 years. So I would say that's our claim to fame, if you will.
That's good to know. Good. So you get people quicker, faster.
Yep, absolutely.
Get them
better. While it is physical therapy, we like to think of ourselves as like a sports performance physical therapy clinic. We focus on the athlete, and the athlete can be an 18-year-old high school quarterback or a 65-year-old endurance runner or anything in between. Just because we work with athletes a lot doesn't mean we can't work with the general population too.
Okay. So, in your opinion, of course, what do you think holds people back from getting started with somebody like yourself, whether it's post-surgical or maybe they just want to improve their overall quality of life? What do you think holds back people typically from coming in to get your kind of services?
You know, I think with anything that is involved with whether it's rehabilitation or fitness, it's the understanding that there is a major change that needs to take place. And people see, oh, great, you know, they hear I need to exercise X amount of time or days per week in order to get where I need to go. And while that's true, you have to start somewhere, because we don't all just start with, hey, I'm going to exercise 5 days a week for 2 hours. I'm going to do my weight training and my cardiovascular exercise along with all my stretching. You have to start somewhere with something. And I think that's the main barriers. People cannot perceive how they're going to reorder their structure and their lifestyle and their schedule in order to now add in something that they needed to do before, but now they're being told they have to do it. So I think really that's the main barrier, is understanding where can I fit in my PT or my exercise in my daily schedule. Once they have accepted the fact that there's a lot of places that they can fit it, then they'll get started.
Yeah. I mean, I deal with similar issues with my clientele that come in too, is because, you know, like you alluded to, we need to almost get after it quite a bit in the beginning. We need to see, we need to get on top of the condition or whatever the problem may be. And it's finding the time and almost making the patient realize that it's important and putting that investment in. So
yeah, I'm sure, you know, being your clinic and such is understanding, hey, what can I do in order to not only get you better quicker, but also have you understand that this is a fix, but it's not lifelong. You come in one time and you're better and you're ready to go. You know, you got to stay on top of it on your own too.
Yeah, absolutely. Got to manage the expectations.
For sure.
So getting off topic a little bit, as far as getting more towards wrapping things up with you, it could be related to your industry, it could be related to coaching, it could be related to anything. But what's the like the best advice you've ever received that you would like to
Sure.
share with people?
The best advice that I've ever received, I would say, is to understand that you don't have to do everything perfectly, but you have to do something well. So for my career being a coach, I won't pretend that I am the best strength coach out there on the market, but I do know, coming from an athletic standpoint, how to work with an athlete. And I think that sounds like a lot about me,
Sure.
but when you take it on a personal level and you're wondering how to get started with fitness or lifestyle or wellness, is you don't have to be, an amazing runner that runs a 5-minute sub mile. You don't have to be able to lift 600 pounds to get better or more fit. You just have to know, what can I do well and what do I like? And if I can do those things, I can progress myself. So it's teaching the person how to empower themselves through that piece of advice, to me, was the best that I ever received, because I can write the best program ever with the most scientific data behind it, but if you don't do it, it doesn't matter.
Yeah, I mean that holds true for so many things in
Yeah,
life. So yeah, I like
absolutely,
that. That's
for
good.
sure.
So what would be a recommended resource or guide for people, mainly when it comes to if someone's interested in exercise physiology or interested in learning more about, what
hmm
that really means, because we don't have the time to really dive
hmm
into it today. What would be a good resource for people who are
I
interested in
think a
that?
lot of people get scared about, you hear like exercise physiology, you think biochem and all this complex, difficult stuff. And while I shy away from the internet, there are a couple great resources online that you can find. Some short videos on YouTube per se. You can look up, hey, what is metabolism, or what is cardiovascular exercise,
Hmm.
and try to find things that are evidence based. Meaning that if you're going to go to a site, go to a .gov site. The American Heart Association, for me, is probably, for anybody looking to understand health, heart health, and just overall well-being through exercise, probably one of the better places to start. And I would start there because you get little tiny tidbits, and you'll see things like, hey, like, fat metabolism or cholesterol, and you're like, well, I want to know more about that. But start there because they'll give you the basics, and then move on with more complicated texts if you want to. But you don't by any means have to buy a textbook and read from it. That's for us nerds to do.
Yeah, right, right. Or, like myself, who's constantly looking at research. I don't recommend people go
No,
look at research. One, it's hard to read and make
absolutely.
sense of, and then there's
Yep,
different levels of
yep,
quality of research and everything else. So it's not the
yep,
funnest read in the world. But yeah, I like the .gov. I think that's a very good start, and they usually put that in a language that, layperson
absolutely.
can understand, and
hmm
it's a quality source. Stay off
Yeah,
of
please
Wikipedia,
do.
right?
Please don't believe everything that you read, because most of it is not true.
Yeah, yeah, you gotta be
Yeah,
careful nowadays. Ton of information, but not all
absolutely.
of
And I
it's
think,
good. So I guess as we wrap stuff up for people, what's your one parting piece of guidance? And then if people are interested in learning more about your services and even more about Achieve, what's a good research, or an email, or some way of them
sure.
reaching out to
So
you?
parting advice is, if you're going to look up stuff on your own, just cross-reference it with other things. If you read something that is the next newest or hottest fitness or wellness thing out there, if that's the only article or post about it ever and you found it on Facebook, it's probably not 100% accurate. Trust the internet to a certain extent, but don't believe everything you hear on the news. Like getting in the bath is the same as 30 minutes of exercise. I heard that one before, and that one made me laugh. So, take everything with a grain of salt, read as much as you can or as you're able to, and go from there. If you're interested in learning more about me, kind of what I do, you want to schedule anything or just simply have some questions, you can always just shoot me an email. And it's, my last name is J and DePasquale, and I can provide that to you so people don't have to try to figure out how to spell that nightmare at achieveortho.com. Yeah,
Absolutely.
and we also have a website, dr3therapy.com, and that talks more about what we do at our facility and how I'm involved with that. So a good place to start would be there.
What was
It's
the website?
dr3therapy.com. So like doctor3therapy.com. And we got a lot of good stuff on there. So
Good. You said that kind of
yeah, I
quick,
talk
so
a little fast sometimes.
you said it quick. I want to make sure yeah, that people actually heard that in case they want to
For
look it
sure.
up really quick. But yeah, when I'll take this video, I'll repurpose it. I'll make sure I put your email in there too if anyone wants to
Sounds
reach
great.
out to you. And just especially the local people that are watching this right now, I obviously highly recommend what you do and the services that you do because I've met with you and I think you're very knowledgeable and yeah, I mean if anyone has any questions, definitely reach out to John. He's a good guy and he'll help you
Thanks,
out for
Dr.
sure.
Robinson. I mean, I would say likewise too. Again, at Achieve, we know what we know, and at a certain point, we don't know, so we refer out. And talking with you a few times and stuff, it really seems like you're on the same page with me. Of we want to get patients better, and we want to do it as fast as we can with the best resources available to us. That's the goal. Yes, sir.
That's what it's about, man.
Absolutely.
Yeah, it's been a pleasure. It's been fun. I hope some people have learned stuff, and I hope maybe they got to know you a little better and what you guys have available and able to offer. And I look forward to maybe do something like this again and focus on a topic more
Absolutely.
closely.
Sounds good to me. Thanks, Dr. Robinson. Appreciate your time.
Yeah. Take care.
All
Have a
right.
good rest of your day, everyone, and
Thank you.
take care, John.